So good morning, everyone, and welcome to our annual Black History Month Symposium. This is something that we do every year as a way of giving back to the community. So what I want to do is take a few minutes just to explain about the foundation in case you're new to one of our sessions. So the Walnut Foundation's motto is empowering men to take responsibility for their health. So our history is, this foundation was started about in 2007 by two men who were diagnosed with prostate cancer and went out into the community looking for answers or looking for information, and they couldn't find it. So they formed the Walnut Foundation as a way of educating men about their own health. So our purpose is to work with the Black community in the Greater Toronto area in identifying the needs of Black men and their caregivers in the area of health-related and related issues, and to provide a forum for discussion in a comfortable, safe, and supportive environment. So the message we give to men as we do our work is to know your family history, especially for things like diabetes, high blood pressure, prostate cancer. It's very important that you understand your family history. We advise men to get screened early. Getting screened early is very, very important. We advise men to get to know your doctors, to build a relationship with the doctor, because that's very key to your health. Your doctor knows everything about you. Know your numbers. We advise people to understand and keep track of their blood pressure, the blood sugar levels, the PSA levels. We also encourage people to participate in research, to join research studies and clinical trials, and that's the only way we can get information to help our men. We advise them to join a men's health interest group like the Walnut Foundation, where we share information. And also importantly is that we encourage them to donate to places like the Walnut Foundation. So how do we serve? So every year we have an annual men's health conference. This is normally at Ryerson University, but this past year it's gone virtual. This annual free symposium we do every February. Last year we did it on Alzheimer's and dementia. This year is on coping strategies. We have monthly meetings with formal presentations. We invite members of the medical community to come in and have a discussion, open discussion with our members on various aspects of health. Last month we dealt with eye health, eye diseases. Next month we're going to be dealing with the future of prostate cancer care in the Canadian health system, specifically the Princess Margaret UHN community. We do a lot of corporate, community, and church presentations to their groups. We do a lot of sharing of health experiences. The men share their experiences of anyone who's journeying through any kind of medical issue. We provide a lot of guide-to-guide support. Anyone who has been recently diagnosed would actually come to us, and we do provide support to them. We collaborate with other groups as well. And also very important, our funding comes from our annual walkathon and from people donating to our organization. We are 100% volunteer organization. We don't have any overhead of staff. So we volunteer. So all our funding, 100% goes towards doing this work like this we're doing today. Okay, and we've got some key partners that we always work with. Movember, you know, Movember, the big organization. Movember True North, the Canadian Cancer Society, the Afro-Caribbean Cancer Consortium, as well as True North. True North is a program that was started at Princess Margaret Hospital. It's designed to provide support to men who are journeying through prostate cancer. So we're a big part of that organization and big part of what they do. So, so what I want to do now is let's get on with the program. I want to turn it over to Charles, who is going to introduce Dr.